Hi, is your lower back bothering you while you run? Is your lower back cramping up or just causing severe pain, which is hindering either the distance that you're able to run or just being able to run in general? This video is perfect for you. My name is Dr. Molly. I'm with Your Goals Physical Therapy, and I absolutely love treating runners. Unfortunately, though, running does come with injuries, and over the course of my practice, I have noticed that there are two big things that I see. Two big reasons why people have lower back pain while they run. And the first one would be just from the force of hitting the ground. Some people end up with lower back pain. And that ends up being the thing that a lot of doctors tell you, hey, you just shouldn't run at all. And I have a little bit different take, so stay tuned. And then the other one is when your lower back muscles are doing too much work. They are so strong that they are taking over and they are cramping and they're just so tight and constricted that it's causing you pain. Now, I actually have worked with many people over the years, so I'm going to highlight two people today. So Susie, when she came to me, she was 38. She had two kids. They were in middle school, and she used to run before she had kids, and it was her like mental escape. So once her kids were independent, and she basically was like, well, I have no more excuses. I can literally run and in the morning before they go to school and get them off, and everybody will be fine, go to work, but I do have to do it in the morning. So she had to renegotiate some things, but she realized that now that her kids were independent, really running, she could make that a priority again. And so she started running, and she was doing so good at the beginning, but then all of a sudden her low back, it was nagging at the end of her runs, and then that nag became a little bit more intense, and it was just slowly over time, it was taking away her ability to run. And anybody who likes to run knows that is just not okay. It's like taking away your best friend. And since she used that as like a decompression time, it was really making her moody. She noticed that her morning routine wasn't as smooth. She was a lot more jittery and sharp with her kids. So when she came to me, she was looking for not only peace from the low back pain, which was interrupting sleep and messing with her at work, but it was also just not making her a very nice person, because running really was her form of meditation, and she wanted to get that back more than anything. And then there's Mark. So Mark was 45 and forever in a competition with himself. And he's read so many things and knows that, eventually he won't be able to run as fast, he won't be able to run as long. So right now he feels like this is his time, right? 45, I should be able to do everything I want. So instead of running half marathons and marathons, he decided he wanted to break into like the ultra marathon running. So those really long runs where 10 miles is like the warm up, right? And so he was just very excited. But what he found is that he'd always had a little bit of discomfort when he was running at the end of his runs in his low back, but now that he was doing those ultra long runs, he was having a whole lot of discomfort, and it was just stopping him from being able to achieve the goal of running these really long races. And so he came to me because he didn't want to feel like he was old and wasn't able to challenge himself like he was up until this point. And so those are my two people, so Mark and Sue. And let's talk about Sue. What happened with Sue? So Sue comes in for her evaluation, and you look at posture, muscle tone, flexibility, watch how they run on the treadmill. And one thing that I noticed that was very obvious with Sue is that when she started off running, everything looks normal and good, but as she started to run, her lower back would actually arch, so she would get more of a curve in her lower back. Let me see if I can get it. So here, I give up on that. So you're supposed to have this little curve in your low back. Well, hers started off normal and then would get really extreme by the end. And that, with her range of motion, you just notice how tight those lower back muscles were. And so when she was getting some distance on, those muscles were tightening up even more, and they were just really clamping down until eventually they stopped realizing how to relax. And so that's why she was coming in with me. Those muscles were just so used to being tight and stiff that at any point, if they were stretched or loosened up, they just really spasmed on her. And so with Sue, we talked about how to make that more balanced. How do we balance out the strength of her low back muscles with her abdominal muscles, with some hip muscles? How do we improve her flexibility? And how do we get all of that to work together while she's running? So those were kind of the highlights of what we did. Now for Mark looked amazing running for the first several miles. But then you started to hear how loud his footsteps got. And the longer he ran, the louder those footsteps got. He also has, the standard, if we're going to pick on guys, right, they're very stiff. So his muscles were very short. Every direction was just very, very tight. And there were some other things. But what that meant was that while he was running, when he got into those 10 miles, at the 10-mile mark, he was just pounding on those bones, and it was going from his foot to his knee to his hip to his lower back. And when you dive a little deeper with people, you find that he has knee pain, has a little hip pain, but he also runs really far. So he just associated all of those little aches and pains with part of his training. So he kind of brushed them off and didn't pay any attention. And he's like, yeah, I know, I'm stiff, and makes jokes, and because everybody who's stiff, that's the common thing, right? But what that was doing is basically the buck stopped with his lower back. Not only was that kind of the top spot that a lot of that compression force ends up sticking with, but when your back hurts, that's a lot scarier for most people than when your knee or your hip hurts. So if you're going to have back pain, most people just want to stop whatever that is, because having back pain is very, very scary. And so that's what drew him in. But we came up with a nice plan to go over how to improve his overall flexibility, because stretching was just not doing it for him. So we had to come up with other things that would help him get past his ligaments and his muscles being so stiff, and then work on his endurance at the higher end, right? Because you're not just talking about running 5-10 miles. Now you're talking about running really far. So your muscles have to have a whole lot of endurance and a whole lot of muscle strength. And then you have to be able to know how to land softly. And that's a little bit of coordination and some other things that just need to be honed. Just like any other skill, you just have to learn how to practice that. So those are the two big things, is people have either overactive lower back muscles. So it's very rarely that people have weak backs. It's much more common that people have almost overly strong backs, especially in your low back. And then the compression, the compounding forces. And again, that's the one, just the ground reaction forces. People talk about how much beating your body goes through while you're running. And albeit that isn't inaccurate, but if your body is trained to absorb that impact and the muscles are able to help you do that, then the bones don't take over as much of that impact as people like to imply. There just takes a little bit of training to get that to work in. And then you can run well into your 60s if that's what you want to do. So those are my two people that I wanted to highlight today, because now they're off doing their favorite thing. They're back to running. Mark is challenging himself all the time to run, better and faster, and he's still on that goal. And Miss Sue, she is able to decompress so that she can come back in and deal with all the stresses of being a mom between working and kids, and it can be a lot. So if this is the type of thing that you're looking for, if you're suffering from lower back pain while you're running and you're trying to find a remedy that doesn't involve giving up running, injections, surgeries, then feel free to contact me. At the bottom of this, I'm going to leave a couple ways to get a hold of me, and you can just pick which one works the best for you. And I hope that you're having a great day.